You just said that you will never encourage anyone in your family to become a doctor.
My journey is not simple. I don't want anybody to go through that again.
So, will you ever recommend your kid to become a doctor?
No, I will not.
Tell me about your MS days.
I think I would say one of the toughest time period of my life. My other colleague, she was a very softer one. She got slapped.
Did you face a lot of gender discrimination?
Yeah, I think especially because I started talking back and being stern on what I deserved.
Tell me the difference between AIMS and JIPMER.
You know, in JIPMER, every day I had to ask myself, why me? Okay, maybe because I'm a lady. It never happened in AIMS to me.
Do you think surgeons in whole are the most egoistic of the doctors?
They think that they might be judged, but nobody is judging.
How much does a breast and endocrine surgeon earn in our country? Like immediately after doing MCH, 10 years down the line and 20 years down the line. Hey guys, welcome to the Nachiket Bhatia Show, now sponsored by Curenza, powering India's healthcare hiring. Find your dream medical job at curenza.com. So today we have a very special guest, a consultant breast and endocrine onco surgeon at KIMS Kondapur, Hyderabad, and one of the very few women in India performing both breast oncology and endocrine surgery at this level of expertise. She completed her MBBS from Gandhi Medical College with distinction across multiple subjects before training at three of India's most coveted government institutes: MS Surgery from JIPMER Puducherry, SRship at AIMS New Delhi, and MCH in Breast and Endocrine Surgery from SGPGI Lucknow. We are going to discuss every aspect of surgery with a female surgeon, and yes, there is a huge gender bias happening. We are going to listen this from the lion's mouth. Let me tell you guys, it's not easy being a surgeon, and it's most difficult being a female surgeon in our country. So let's put our hands together and let's discuss this very insightful topic with Dr. Ramya Valiveru. So welcome Dr. Ramya to the Nachiket Bhatia Show.
Thank you very much. Much awaited.
Doctor, we are always looking for great female surgeons because I think you give a very different perspective to the field of surgery, and we all know it is a male dominated field.
Yeah.
So before we get into that, I would like to know your journey. How did you start? You got into the field of medicine and then surgery.
So it was a very humble, nothing great. I'm from a place called Anantapur in Andhra Pradesh, and very simple family. There's no doctor in my family. I'm the first and hopefully the last, because I'll probably discourage anyone from becoming a doctor in my family. So it was just a very casual discussion at home. You're doing well in studies, and I got good marks in class 10. Abhi karna kya hai? What should I do next? So my father suggested that since you're good, there's nobody doctor in our family, probably you can try medicine because you will anyways crack it. That was how it started. And so I gave the +1, +2 in an MCET, and my rank was 24. And so I chose Gandhi. So that was the first time, even as a 20-odd-year-old, 19, 20-year-old, I made the first choice. Usmania versus Gandhi used to be the thing back then. So people who get good ranks would choose Usmania, and then comes Gandhi. But then I thought practically, and I'm like, no, I want to be in a college where there are extracurricular activities also. So I wanted to have a rounded life. So I did my research. I spoke to a few people. I chose Gandhi. I was ragged for that. But that was a good decision. After I finished in Gandhi, then I got into MS in JIPMER. Then I did my senior residency from All India Institute Delhi. Then MCH Endocrine and Breast Surgery from SGPJ Lucknow. And I'm working right now, in Hyderabad.
Do you regret taking medicine?
Not at all. Not at all.
Yeah, you just said that you will never encourage anyone in your family to become a doctor.
No. I don't regret taking surgery, but my journey is not simple. I don't want anybody to go through that again. But I think I am made for surgery. I will not even say medicine. I'm made for surgery. So I had my own doubts back then when I was choosing surgery. But I think the maximum happiness comes when I'm performing the surgery and patient. Rest all around it is not at all recommended. Suffering is not recommended for anyone. So I think I don't want my family members to go through it or my friends to go through it.
So will you ever recommend your kid to become a doctor?
No, I will not. No.
Okay, tell me why.
See, it's not worth it. I think back then there was this thing of I have to prove myself, that kind of attitude. It also comes from some sense of seeking validation from society or whatever that is. I'm also good. I'm good enough. That sort of attitude. So now I feel that it's not needed. Whether you're working, you're not working, you're a doctor, not a doctor, whatever it is, you don't need that kind of suffering. And so, if my goal right now is to have a rounded life, balanced life, you don't have to be a doctor unless that's your calling. If suppose my daughter says, no, this is my calling, I want to do this, I'm nobody to stop. But if she asks my advice, I'm saying no, no medicine.
Tell me about your MS days.
See, I did from JIPMER 2012 to 15. So I think after about, they say 6-7 years of not having women postgraduates, we three of us joined together. I think I would say one of the toughest time period of my life. Even in third year, just before exams, there were days when I'm like, why am I doing this? I want to quit. So that was there in first year, maximum in first year. Then again back in third year. So yeah, I think one of the toughest. If we can use the word toxic, it is toxic.
What was your days like in your first year of surgery?
Don't count hours. I probably did not eat breakfast for many days. No breakfast and late night dinners. I and my colleague, Dr. Ishita, we used to go to nearby beach to have some dinner many a days. And I think no bathing also for many days. Stinky aprons, a lot of patient care. Yeah, this is how I would describe my residency. Maybe it is worth it to an extent, but it can be done in a different way.
Doctors and paramedical associates. So this tool is a blessing in disguise for all healthcare professionals. Are you still confused how much your salary should be? Curenza has created a very interesting tool in which you can feed your experience, your age, your region, and the tool shall tell you what should be your apt salary. We have collected data from all across country by talking to different ages of professionals, and we have got the most precise data in the country to decide your salary. It's superb. Go and try it now. It's simply available at curenza.com. Yes, powering India's healthcare hiring. Did you face a lot of gender discrimination?
Yeah, I think especially because I started talking back and being stern on what I deserved. Yeah. But then my other colleague, she was a very softer one. She is also a consultant in PGI Chandigarh now. She got slapped by a senior.
Male, female?
By a male. Slapped on her face.
A male slapped a female?
Female. And see, I'm talking back and I'm fighting for my rights. I get discriminated. My other colleague is soft. She will face these kind of things and then all kinds of things happening to her. My other third colleague was a very diplomatic, even today she's a very diplomatic person. Even she, yesterday just I was talking to her. You know, it's always there. It doesn't matter how you are.
Why was she slapped?
Because she failed to carry on some activity that was told to her for a Whipple's patient, which had an implication for the patient, something like that.
Coming on to your gender discrimination, what all happened with you?
So, you know, when I joined, the then director of JIPMER, he's no longer in the position. So he was taking rounds, and when he saw me, and then of course he was talking to the residents. So, did you join surgery? I don't think you'll be able to survive. So this is what a director of an institute is straight away telling me. And that actually kind of jolted me a bit. Will I really be able to do or not? But then I chose surgery because from a long time I wanted to be a surgeon. So I knew that it's going to be tough, but it proved to be tougher than what I thought. I think if you are fighting back, you'll be labeled as aggressive. If you don't fight back, then they will walk all over you. Either for surgical, there is no discrimination in assigning work. They will never think for a day that you're a female, probably you are probably weak and you need some rest. Then they will never think like that. But when it comes to OT chances and you getting slots for your operation theatre, then there's a lot of discrimination. So even if there is one person supportive to you, that person will not be able to support you because other people, there's a risk that he might be, looked differently at by that person. Mainly, I suffered in operation OT chances while I was getting trained.
So while during doing surgery, did you ever think कि you would have done better in medicine because a little bit equal chances over there?
No, no. I had to do something with my hands. So yes, I think this is a journey how I got into this training and the kind of training. But as far as my satisfaction is concerned and the way my work goes, I think medicine would not have suited me. Surgery is the thing.
So
Yeah, I
do
think.
you think all this toxicity is actually worth it?
No, not at all worth it. The same thing can be taught and can be learned without having all these. I think that is what they're striving for right now. So I recently was in Jipmer for a conference, and I had a chance to talk to all my consultants, and now it's a very well known thing that there is toxicity, and they're all trying to rectify it. So it is just that there are people, there are systems, and then they are trying to achieve onto some common goal in the name of patient care. All this happens in the name of patient care. I did for the patient. So these things can be done without actually being so toxic. That is what they are, I think, probably realizing it now. And back then, if you tell even if 1 year senior to you that this is wrong, you're wrong. But there are people who used to be be toxic, and there are people who always were supportive. One of my second years was very supportive. He made me, I actually shadowed him for an entire month, and he taught me how to get things done easily and all. He was very supportive. In fact, he rescued me from some of these toxic seniors many times. I'm very grateful to him. And we had a lady professor. Any time of the day, I could reach out to her. She was very helpful. My thesis guide, he was very helpful. I think as many people are there who unknowingly or knowingly are toxic, there are many people who are helpful also. Yeah.
When do you decide that you want to pursue the super specialty branch?
So, first of all, when I got out of MS, I was not feeling complete. I did not feel that I had enough training. There is no choice but to. If I had left on my own after MS, I would not have been able to do major surgeries except fibroadenomas or say, what I would say. We used to do a lot of intestinal anastomosis, GI work. I think GI work, we saw a lot and did a lot, but not the other kind of things. So there was no choice but to do a super specialty. That was a given. So when I then got married after my MS, I moved to Delhi with my husband. I joined AIMS. So another chapter of surgery opened. So though Jipmer has a lot of patient load, the facilities were very less. When I came to AIMS, it's a whole class apart. And I was in trauma center briefly for about 40 days. I was quickly, as if destined, I was quickly absorbed into Unit 2. And I think that changed a lot of perspective. I was scrubbing into renal transplants, bariatric surgeries, endocrine surgeries. For the first time in my entire life, I saw a case of parathyroid adenoma, and my professor was so enthusiastic and passionate about parathyroid diseases. So it quickly, got into me. So it
Tell me
was,
the difference between AIMS and JIPMER.
oh, a lot of difference. For me, at least, maybe I'm also a senior resident, and I did not, in Jipmer every day I had to ask myself, why me? Okay, maybe because I'm a lady. It never happened in AIMS to me, frankly. I may have been the lucky one, but facilities wise, the training, just within few months, I think my exposure, my confidence, and the way I was interacting with my colleagues, everything had changed. So I think I was lucky to come to Delhi, especially to be in AIMS. That entirely changed my perspective.
But like, what was different?
So as I said, exposure. So my professor taught me how to do laparoscopic cholecystectomy. So he was particularly fond of Jipmerites. I don't know why that worked out for me, and just the level of discussions and the cleanliness. Acha, one more thing is, in Jipmer, apart from my own work as a resident, I used to do all the nursing work, orderly work, shifting patients, all this kind of work. In AIMS, that is taken care. Nurses would do all. I think nursing care was another level in AIMS. So you are actually you're wasting your time in these kind of things. Even junior residents, I don't think they were doing these kind of things. So in fact, I used to push that, they don't encourage doing emergency cases. But I am so used to doing emergency cases back in Jipmer. So arranging beds was a major problem. But then we managed to operate a good number of cases, very rare cases, and especially endocrine. And the academic discussions, the common departmental discussions that we used to have, journal clubs, and I think the exposure became geometrically much more, progressively higher standards.
Why did you choose endocrine surgery as your super specialty?
So multiple reasons. So first one thing is I was in the back of my mind I was doing my own research. What next? I know that I have to do MCH. What is the better option? I in fact prepared for GI surgery for a while because I was still in the mode of proving to others. I told you in the beginning, right? So I can also do this. This automatically got into me that I have to be equal with men. And so when that kind of was there in my head, I was preparing for GI surgery. I got 97 percentile in AIMS entrance. Probably I was the 7th one. 6 people they called for interview. So I got into that percentile, and then at that juncture, I happened to attend a GI surgery meet in Hyderabad in AIG. I was in Delhi. I attended in Hyderabad. So there were 300 people, only myself and yet one more lady. Somehow it shook me. Like, no, this is not for me. 3 years of toxicity is enough. No, I'm not going to make this my whole life point. Ki I'm also there. Notice me, I'm also there. I'm also doing good work. Give me also chances. This energy I'm not going to spend into. So that thought came to me. Then I literally prayed for one whole day. Ki I have a guru, Paramahansa Yogananda. So I literally prayed, and then I was asking for guidance. And next morning, I happened to look into a WhatsApp post where I noticed a name whom I'm familiar with. She is one of the toppers from my state. She took up endocrine surgery. So I called her up. So what is this endocrine surgery? What do you guys do? She was already into first year, and then she's like, this is the department where we do thyroid and breast also. That became a bit attractive to me. अच्छा endocrine surgery में तो ये reflect नहीं हो रहा कि ये breast surgery भी है इसके अंदर. But that attracted me. So then I was preparing for endocrine surgery. Then NEET happened. Until then, you didn't have NEET. 2017 was the first NEET SS that happened, and couple of months back was my AIMS GI surgery entrance. Probably I was the 7th. Only you get 6 ranks. So beyond that, you don't know which rank you're in, but we have a group where you can figure out probably where you're standing. तो अब मेरा ego satisfy हो गया कि अच्छा I have prepared well enough and I'm capable of doing. So then I gave the NEET exam. By the end, when the results came, I was very clear that breast surgery is the thing because I'm a lady, and I will be able to help more women, and I will be sought after because I'm a lady breast surgeon, and this course seems to be very streamlined. I had attended one of their conferences even before I joined. I went to a PGES. So there I figured out that, okay, this is good enough for me. Then I applied in the NEET SS, but fortunately or unfortunately, SGPJ seats did not show up in the round 1. So my next option in the list was surgical oncology because that also has breast. So I joined Kidwai, then I went to RCC Trivandrum in round 1B. And when the round 2 happened, I left all that and joined breast and endocrine surgery.
Tell me about your SS days.
When I joined, one of our professors, I heard that you left surgical oncology and joined endocrine surgery. गलती से भी ये मत सोचना कि यहाँ पे काम कम है, बिना काम किए हुए चलेगा. So this is what he told me in rounds. I'm like, no sir, it's not like that. I joined here because I want to clearly do breast oncology and thyroid surgery, and I did my research, and I really want to do this. So I think SGPJ is very less known to people because, as I was saying before we started, that MBBS is not there. Only few MDMS seats are there. Many people are not aware what kind of a level this institute is. Not only my department, endocrinology. Our wards were just across. the kind of cases that we were seeing, the kind of syndromes, you only probably would read in textbooks about this. My research was on multiple endocrine neoplasia type 2A familial. I just with just a 50-60% of the data that I had 24 families. I published it in World Journal of Surgery. Much beyond that, I think the level to which they go, the research that happens it's really inspired me. So though I am all for breast oncology, when I do thyroid surgery, that's when I just become so happy. The finest, your results are out just the next minute. You have to preserve voice nerves. You have to preserve the extra ABSLN, external branch of superior laryngeal nerve. You have to preserve parathyroids. So your result is out once the patient is extubated. So this, and parathyroid surgeries are so satisfying. 100% outcome. Patient is suffering with all the classical moans, groans, and psychic moans, and all these kind of things. And the moment you operate them, you have actually given them rebirth just with a simple operation. But if you identify the parathyroid, it's a simple operation. But that is the whole science behind it. This I think only if you undergo this endocrine surgery training, you can understand. You're actually bridging the gap between endocrinologists and just being surgeons. So you have both medical perspective as well as surgical perspective. How much adrenal to remove? Not every adrenalectomy needs to be removed. The entire adrenal needs to be removed. You need to be able to preserve these are vital organs. So which syndrome, how to evaluate, what all organs, how to diagnose. It's a very challenging, interesting kind of journey. And another thing that struck me a lot while I was training is the professors that were there in SGPGI. Suppose our latest research is out. Generally, it will be students who will be aware first. वहाँ पे क्या था कि they will be the ones that will be aware first, and morning 8 o'clock, even you can be 5 minutes late, but they will all be there in the class. Very, very academically oriented, internationally recognized. So that, I think these things help when you actually want to excel in your profession.
I'll ask you an observational question here. You told me that you are not good in Hindi. Am I right here? But how did you survive in SGPGI Lucknow?
नहीं, उतना तो आता है जितना पेशेंट
पेशेंट तो वहाँ पे बिल्कुल देसी हिंदी बोलता है.
No, I can understand patient Hindi.
नहीं, मैं मेरठ, I have studied for Meerut. All right. Okay. When I used to go to my internships, they don't speak desi, I mean normal Hindi. Even they speak थोड़ी में दर्द हो रहा है. Those are the kind of dialects they have. All right. Yeah. It's a Meerathi dialect.
Correct.
It's a Lucknowi dialect.
Lucknowi.
So how did you understand that?
I was able to understand it. Language was not the problem. In fact, language was a problem, though there is a common wording between Tamil and Telugu. Problem in Pondicherry, Hindi was not a problem for me somehow. Baat karte karte, I think I managed. We had a Tamil to Hindi translation book in Pondicherry. With the help of that, I learned Tamil. Hindi somehow, I never had a problem.
Okay, so you had a language problem in Jipmer.
Yeah, initially. Then by the end of the 3 years, I think I was good at Tamil also. Other thing is, they told me if you don't learn Tamil and don't speak in Tamil, you will not be given cases. So I think we were kind of, it was nice to learn another language.
So what's happening in Karnataka right now कि कन्नड़ बोलना है तो कन्नड़ बात करनी पड़ेगी. वो तमिलनाडु में बहुत टाइम से हो रहा है.
Not in that way, but I was told this on my face that if you don't learn, you have 6 months. If you don't learn Tamil, you're not speaking to patients in Tamil, you will not be given chances. I think these are just told, but I don't know if it really happens. Some of my colleagues and juniors I know who never learned Tamil but still managed to finish their 3 years. It's how seriously you take their warnings, you know.
So that's a threat, right?
It is a threat, for sure.
The point of a center institute is that people will come from anywhere in the whole country. All right, it's not a state GMC. But,
for sure.
I mean, if I, let's suppose, go to Jipmer and I am not able to speak in Tamil, it's not an easy language.
Yeah.
All right. I mean, then you're telling me कि आपको cases नहीं मिलेंगे. Yeah. So isn't that partiality?
It is, and that's what was told, and fortunately I could learn in 6 months. And now I have another language in my armamentarium. Yeah. But that's what I learned because I was scared.
So what's your advice to, NEET PG aspirants who crack NEET PG. So many North Indians get a college in South India and the vice versa. Normally, what I suggest is that you should always choose somewhere where you are language complacent. Your language should not be a barrier. You're going to, let's suppose, maybe a college in Tamil Nadu. Patients are speaking Tamil, consultants are speaking Tamil. Learning will always have a language barrier.
Consultants used to talk to patients in Tamil, but talk to us in English. They're very highly learned, polished English and all that. I think my advice to people is, if you have options, choose which is simpler for you. Why do you want to struggle learning a new language? I think there's no point. But if you have no option, or if you feel that that particular institute has something which other places don't offer, then I think it's worth going there and learning the language.
Any moment in the whole SS days which you remember very fondly?
Yeah, just came to my mind. You're supposed to pick chits to choose your guide. Okay, so one professor is particularly more inclined in breast. So if you take, if he's your guide, you will get one project in breast oncology, which I wanted to do. So I was praying, and I will pick his name. There are 4. My rank was the top amongst the 4, and there are 4 consultants who are due for being guides in that particular year. So I picked a chit. It came that name. I was like, yay. And then something happened, and they were like, no, we are going to choose again. I don't remember exactly why we had to choose again. Again, they put the chits. No, like, okay. So I was eyeing that chit, which I left back. I went and picked it again. So I just remember that. Yeah, another thing is when I was awarded this Professor R.K. Sharma Gold Medal Award, it was COVID time. I was at home in Bangalore. I was 7 months pregnant, and my professor took it happily for me. So I was very happy that my professor, who really guided me all 3 years, took it for me. That I think that I was watching it live, and it was very, I can't describe. Yeah, I was very proud. In fact, when I was in Pondicherry, I had bought a small plaster of Paris idol, a girl with her robe, sitting on books, holding a gold medal cup in her hands. It never really happened to me until in SGPJ. My mother was like, no, one day you will get a gold medal. I think that was the moment it happened, and I was very happy that my guy took it for me.
You went to abroad after your SS to do a fellowship, right?
Yeah, so actually twice. One for observership, I was in Germany during my MCH. So that was a norm. You will go for observership to a couple of international places from SGBJ. And I also got grants for going there. And I was in Germany to observe retroperitoneoscopic adrenalectomy. So to a professor who developed it himself. It was a good experience. And then it is not a study in fellowship. It's a 3-part exam. And then you have to go for an exam to Hungary. So it is one of the highest degrees for breast oncology in the entire world. So I wanted to be that. It gives you more exposure. You understand where you stand. Is there anything that you need to learn more? Because when I call myself a breast specialist, I should be worth it, right? There are so many people who do breast surgeries. It's not just operating. You need to have so much more knowledge about the survivorship, what else can be done, and what are people in the world doing, what are the new advancements. And you also get to meet people, peers like you, from other parts of the world. So that is the fellow of European Board of Surgeons for Breast Surgery. And then I knew that robotic surgery is going to come a big way. So in my first year of practice, I also did 1 year FARIS fellowship, that is robotic surgery fellowship, where I got exposed to how robotic surgery is done. When I was in SGPJ, in my final year, we got the Da Vinci Robo. And it was COVID time. I didn't get to really be hands-on. And my professors were still getting used to it. So that gap I had to bridge through this FARIS fellowship.
Tell me about your days after doing MCH. Like after fellowship, क्या किया आपने?
So fellowship was during my practice only.
Okay.
So after I finished my MCH, I delivered my baby and I was at home for about 6 months. And then I was very restless because I wanted to get back to work. खुजली operate नहीं किया तो खुजली. So I was looking for jobs, and the day when I gave my exam in SGPGI, one of my seniors, another fellow endocrine surgeon from Hyderabad, contacted me from Apollo कि आ जाओ Hyderabad, we'll form a team. It was on the back of my mind, but then I was trying, because we have our own house in Bangalore and my husband's company is in Bangalore. I was looking for jobs in Bangalore, and I was offered a fee for service job in Bangalore. I was not very attracted to that particular job. And then just another small deviation story. When I was taking breast and endocrine surgery, one of my professors from JIPMER and many people in fact are like, "Ye kya hai branch le rak- what are you even thinking of? So when you come out, you will not have a job. There is no real recognition to this branch." So this kind of guidance was coming, which probably they're not wrong. I remember telling them कि कोई बात नहीं, I will bring a recognition to the branch. And I remember telling my husband that, see, when I come out, I will be offered a job in Apollo Jubilee Hills. I said this 3 years back. So, and that happened on the day when I gave exam from this colleague of mine from Apollo. And then I contacted them. He told me to mail a particular person. I mailed them. Then they took me as an associate consultant. But the reality was completely different when I landed in Hyderabad. I thought that, okay, I finished my MCH, itne thyroid surgeries kar liye, itne breast surgeries kar liye, now it will be a red carpet welcome for me. She is coming, from JIPMER, AIMS, SGPGI, the trained breast surgeon. बिल्कुल reality ऐसी नहीं थी. When I joined, I was called an associate consultant, and I did not know what was associate consultant. Then it's like a glorified
Yes, sir.
registrar. तब समझ में आई. Another sad thing that happened to me was I used to sign a register called temporary register. It was a shock to me. Every day I'm supposed to go and sign a register called temporary register in Apollo. It was very demeaning. Like, why am I signing this register? Ki aapne, today you came, you signed this. I told my colleague that, what is this temporary thing and all. He's like, nahi, I'm not, let me find out. And things like that. So, anyways, wo chal raha tha. But in reality, what was happening was, I'm doing all the groundwork. I don't mind doing the groundwork. So I was doing it. Though I had a small baby, I would come 2 hours before the consultant comes, and I was taking care of making rounds and trying to, when OPD patients come, I was trying to converse with them. But then slowly I realized ki what they're expecting, he's expecting from me is not this. He just wants me to do the groundwork and not get involved with actual talking to the patients. And he did not mean me to be actually a team player in his team. And one fine day, I think it also had become a thing in the operation theatres that the operating time that he was taking has come down significantly once I joined. Obviously, when you have another trained alike surgeon like you across, the OT time will come down. So, and then he would comment about the way I hold the instruments and the way the bag I carry, what I'm eating, who am I talking to, all these kind of things. It was very uncomfortable for me. And one day I pointed out that, probably we are injuring the nerve, and the way it was handled was not at all respectful for me. The next day, immediately the next day, I was given a bipolar stillet in my hand, and I was doing it in the patient's tissue, but the control was with my colleague, and he did not press it properly and it did not burn. He yelled at me. I stopped there and said, "Sir, you should give me respect. I'm your colleague. I'm not your servant. You should give me respect." He got pissed off. He's like, "You get out of the case." I got out of the case. Then he came back after the surgery was over and told me some work. वहाँ जाके patient को देखना. I said, "I will not." In that moment, I decided, done is done. I'm not going to go back to this person. Without any respect, I'm not... See, in training, all these were common, and you yell at people for different... If they've really done something wrong, yes, you can shout at them. But this was... Somehow, on that day, I decided, I am not going to go back into the theatre with him. So... Once a few days passed like this, and then then I went and spoke to the management, the person who employed me. So immediately the next day, he calls and tells me, "See, I think Ramya, you should just silently leave the place." The management person, so I should not make it into a big deal. Just silently. I'm like, "Why will I leave? because you promised me you're going to give me a position. You said that being a certain breast surgeon in a certain hospital in Hyderabad is going to be a huge thing for you. I have left a city and I've changed the city to come here. So it's all of no use because he's an established consultant and you've just come there and nobody's going to listen to you. I tried talking to many people. I raised my voice. Nothing works. And then one fine day, he just blocked all the login IDs, and so I have no option but to leave. Okay, I thought that fine. I have so many degrees. I'm so good at my work. I will find a job. Then came the real struggle. So I came out of Apollo, and now the next job is a tough one for me. So wherever I went, they were impressed with my CV, but then they will call where I have just worked, and he did not really help me there. And then finally I landed in KIMS, and I spoke to the chairman of the KIMS. He offered me a job, looking at what is in front of him rather than believe. Probably they did not even inquire how I was or whatever, because I was just starting out of whatever reason. So they believed in probably the work that I would bring and the confidence, the kind of way I was talking about my vision. That's how my journey in KIMS has started.
So did they tell you that the first 6 months are basically
No.
trial period?
No. In fact, the person in the management who spoke to me are like, see, since you are just freshly passed out, you will be under this guy, but we're actually looking at a very long term. You being one of the breast surgeons at this center in Hyderabad is like, you are one of the cream la creme. This is the picture that I was shown, for which I took the step. But when I came, it's completely different. You are sitting like a jewel in somebody's OP. It was completely a misrepresentation of what they had in their mind. I think management is not a part in this. I think the person who told me that we are going to do a certain teamwork like this was at
No, the
fault.
management is the biggest part in this. You understand, right, that why they gave you a temporary job?
They did not stand with me when I went to them. Then now other thing is I had no idea that मुझे लगता था कि आप डिग्री ले लो, आप सर्जरी सीख लो, अच्छा काम करना है, जाके बैठना है, पेशेंट आ जाएंगे, you have to operate, then hospital is happy with you. No, patients don't walk in. You have to solicit patients, you have to attract patients. This was another shocker for me. So people who already...
I'll get back to that.
Yeah.
Do you understand why they gave you a temporary job?
No.
Did you ask them why? Did you get a chance to ask them
No,
why?
I did not get a chance to...
How many months were you there?
I think I joined in September. I was there till March.
I think
February, March.
5 or 6 months?
5 months. Yeah, 5 months.
They fired you at 5 months.
Yeah.
All right. So normally what happens is you can be given 6 months of probation and then they make you a permanent employee. All right. Until if they could fire you before 6 months, you are a temporary employee. They don't have to give you any benefits. Otherwise, you would have got a lot of benefits from them.
Oh, like?
I mean, they can't fire you. I mean, till probation, they can fire you on a moment's notice. And let's suppose you are a permanent employee, they have to sign a employment agreement with you. And let's suppose there is a 3 months notice in that. So if they fire you at the spot, they have to basically give you 3 months of salary. And it's vice versa. If you resign, even then you have to serve a 3-month notice.
So the hospital did tell me कि ठीक है चलो इनके साथ तो हो नहीं पा रहा. Do you want to work under that person, under this person? I'm like, no, why will I? I was not treated like a specialist that I was supposed to be. I think there was some gap. I was basically trying to cater to this person's needs than what actually hospital is looking for. It was a very sad situation.
Was it an outsourced department?
No, it was a full-time department in the hospital.
Normally, a lot of hospitals, corporate chains in Delhi especially, they have outsourced the complete department to a doctor. So a doctor makes the whole team and everything. The hospital provides them infrastructure, and then there's a revenue share.
No,
so it's
I don't think so.
So everybody is on Fortis. Let's suppose if I talk about Fortis,
Example, yeah.
every employee is under Fortis, but not directly under Fortis. They are directly under a doctor only.
As long as as far as I'm aware, it's not like that.
Okay. Tell me something. What went in your mind like 30 seconds before a critical surgery? As a surgeon, I'm asking.
Now there is only prayers. Because already I would have planned the surgery in my head when I see the patient in OPD, when I look at their imagings, when I look at their CT scans. You know, I go to the ultrasound room myself when I'm operating breast cancer patients. I just don't look into the films in my room. And we have a wonderful breast radiologist. She's a lady and she's amazing. So we both together look at the images and do ultrasound scan in my presence again, even if we have done the scan. And what extent of surgery, the flap that I'm going to do, the reconstruction that I'm going to do, and frozen that everything is pre-planned. I think surgery would have been planned the 30 seconds before I'm praying. That is what happens in the operation theatre. I tell the God to come through me and operate through me.
Do you ever panic if something goes wrong during the surgery?
I might get a little jittery, but when over the years, when I have a tough situation, my mind automatically becomes tougher. It naturally happens now. Probably many years back, I was like that, where it was still conscious level. Now surgery is very subconscious for me. It automatically happens. I've done so many thyroid surgeries that I know where the nerve will be. It's like I tell the sister, see, it'll be nerve will be here, and I lift the thyroid and dissect there, nerve will be exactly coursing over there. I think so many surgeries, your experience does make your surgery very subconscious process. Sometimes when there are big goiters or cancer stuck to the nerve, that is when you have to consciously take a decision and do things. And sometimes there are surprises. So you have opened for thyroidectomy, and then you find a parathyroid adenoma. So you have to take a decision on table. And sometimes all the imaging is showing no spread to lymph nodes, but then there is a spread to lymph nodes, and then the OT time shoots up. So you go and discuss with the family and come back. I think the back end counseling, the trust that the patients have in you, all these helps.
Do you think surgeons in whole are the most egoistic of the doctors?
Yeah. Surgeons are egoistic.
So tell me about this in detail.
See, one example is what I just told. They are taking help. They think that they might be judged, but nobody is judging. In fact, patients will be very appreciative if we have told them, see, I had this difficulty and I went to this particular, called them for help. Patient will not be judgmental, and even anesthesia people don't mind at all. Sometimes they offer कि चलो उनको बुलाना है क्या? Sometimes you're stuck. We operate with nurses, you know that, right? We don't have another surgeon across in corporate hospitals. We operate with nurses. Sometimes they are so young, they're 20, 21-year-old who have no experience in what is operation theatre, what is this instrument. And lamba chal raha hai because you don't have adequate help across. They will prompt you कि चलो किसी को बुला लो क्या? On the other side. So that is one place where ego comes. And the other thing is of the battle, who should operate what? An example. So when I joined KIMS, we had a group, doctors group, where one day I saw a post, one neurosurgeon posting in the group that ये रैंक आई तो ये सर्जरी स्पेशलिटीज चूज़ करेंगे. उसमें लिखा था कि आपको कम रैंक आई तो you will choose endocrine surgery. It was some post like that. I got so offended. It was not needed. And then there was a discussion why some people choose endocrine surgery. That's absolutely wrong. Then I forwarded all my ranks, all my choice of seats. That in fact I did choose Kedwai because it was my second option, and then I had to go to SGPGI. So even after so many years of passing and you're an established neurosurgeon, आपको क्या पड़ी है दूसरी बंदे क्या कर रहे हैं? Like, what are you bothered about? Why somebody chooses what? For whatever reason they have chosen. It was totally uncalled for. And then I overhear surgical oncology colleagues telling कि yes, only surgical oncologists can operate cancers. Who are these urologists to operate renal cancers? Who are these GI surgeons to operate, say, colon cancer? And then who are these breast oncologists today? उनको cancer treatment नहीं आती है. That comes from a pure place of ego. If you are trained in doing something, you do it. You are nobody to tell which specialty does what. It is NMC curriculum. You should ask NMC why they have these many overlapping kind of branches. Nowhere in the world there is one person who is called surgical oncologist. There is a department of surgical oncology. There are people who do different kind of organs. So somebody specializes in colon and breast. Somebody specializes in only breast. In Tata Memorial Hospital in Mumbai right now, there are surgical oncologists who practice pure breast surgery, who practice pure head and neck, pure whatever. It's their interest, it's their training. This is again pure ego, that you are telling who should do what. Just leave them there. If somebody is a quack, if somebody is not trained, that's a different story. I think this also comes from a place where you're feeling very insecure. Ki ye aapki pie hai, this is your cake and somebody is eating into your cake. Because patients want specialists. आजकल हम शू खरीदने सुपरमार्केट तो नहीं जाएंगे ना. We will only go to a place where they sell shoes. That too, a good variety of those too. Similarly, patients are also seeking specialists. Either you take the route where you do surgical oncology for 3 years and then you decide what you want to do. But there are some people who are very clear what they want to do. Somebody wants to do, say, uro-oncology. They will choose urology, and then if they want to specialize, they will specialize. But we are nobody to tell them what to do, what not to do. So these kind of comments, telling patients that, they are not surgical oncologists, this is also done. That is very, very uncalled for. So all these things come from ego and insecurity. If you're very insecure in yourself, then these things happen.
What was the age of the youngest
Breast cancer
Breast cancer patient?
16.
And what was your conversation with her like?
So actually they came for second opinion. So they were in denial. Though we had all the evidence that there is this biopsy report that is showing malignancy, and there is a PET scan showing this parietal lymph nodes. They were in total denial. I mean, what will a 10th class girl understand about fertility, or what will she understand about chemotherapy, the side effects? She is just a teenager who is in a totally different zone. So they had come for a second opinion. So they got treated elsewhere later. But the youngest I treated is 18-year-old. Yeah. So again, it was very tough conversation with them. I don't think they understand. The parents are in shock. I think the mother was more depressed than the patient herself. On a regular basis, we see 24 and above. Some of them finish their family, some of them haven't. So we talk about preservation of fertility and all these kind of things. Disease takes over sometimes. And it's a very tough conversation. Some of them just got married.
What was the youngest death that you have seen?
See, in SGPJ, I think I can't even count, maybe 23, 24. In my practice, not yet so far. They are still surviving, touch wood. But one patient did develop metastasis. I think she will not make it more than few months. She is 33, 34. She had a very bad triple negative breast cancer. She did not respond to the routine chemotherapies at all. There was no response. And within 3 months of finishing the treatment, she already had a massive relapse in the lung. But I think my role comes in not making them lose the hope. I think though we tell the family, that we're mentally preparing the family for her death, patient ko to always we give the hope. Yeah.
You have started your own clinic as well. When did you start thinking about it?
When I left my first corporate job, and then I was looking for second.
Is it before Apollo or after Apollo?
After Apollo.
Okay.
When I
Before
left,
KIMS.
Yeah, before KIMS. I had the idea that, I have to have my own place, क्योंकि कोई ठिकाना नहीं, there's no guarantee that this will not happen again, which is in fact a truth. Another thing is, since I did my MBBS from Hyderabad, and since I started posting in the Facebook and Facebook, at the time I was not on Instagram, that I joined, and many people knew I am a good student, what kind of work I do. So I automatically started getting referrals for patients. So I had patients, I had me, but there's no place to see. So I used to visit my friends or my seniors' clinics and all that. So that is when 3 of my other friends, 2 of them coincidentally, I was working here in AIMS. We had a long journey together. We worked here as senior residents in AIMS. They went back to do their own thing, and we all came back. They were starting a clinic of their own. So I joined them. So that is how I became a part of that clinic.
Do you call yourself a content creator?
I'm trying to be, but I think I have a lot of inhibitions. It's different to do content for information of patients. It's different to do content to have more followers on Instagram. My intent is, if a patient lands up on my video, I think this video helps her to give her confidence in me, just to connect with me. My intention is not to attract patients through my videos. So I think there is a difference. So I'm not aiming at having too many followers on Instagram by dancing. I mean, I'm a dancer. I do dance. If I feel like dancing one day, I will dance. But content creator, I think I have a lot of inhibitions.
Do you think doctors should be content creators,
Yeah.
the educative ones?
Yes, absolutely. क्यों नहीं? Because see, somebody is advising on what to do. What all causes breast cancer? Drink water from a glass. It will not cause cancer. Drink. एक दिन आपने प्लास्टिक उससे पी लिया तो कैंसर आ जाएगी. These kind of videos we are seeing. कोई बोल रहे हैं कि मेनोपॉज को डिले करना चाहिए. You should never age. And all these kind of, everyone is trying to cash on people's fears. So I think it's in our place to give the right information as far as we know. Everything is not 100% in any field. But as far as we know, scientifically proven, it is our responsibility also to put information that is more authentic. I think that is a responsibility. Everyone should be on, social media.
I'll ask you the most loved question of our podcast. How much does a breast cancer surgeon earn in our country? I'll say breast and endocrine surgeon earn in our country. Like immediately after doing MCH, 10 years down the line and 20 years down the line.
So immediately when you pass out, I think 2 lakhs, you start with 2 lakhs. And at 4 or 5 years, you will be at around 4-5 lakhs. And uske baad, it depends on where your trajectory in your career is, how you are. It also depends on an individual, right? Your degree just offers you a training.
True.
How you earn depends entirely on you. I think basic to itna hai. और so from where
10 साल बाद क्या रहता है?
रहता है अभी तो I don't know, because there's no I don't have a number yet, but from what I hear, some of my professors who have shifted from teaching to, they're earning somewhere between 12 to 14 lakhs
A month. And 20 years down the line?
I don't know. I can't say. I can't
I mean, you
answer
must have
that.
some industry experience.
I think it caps to certain level because you're only doing breast and thyroid. You as a person, you can only do so much. If you have a hospital of your own, there's no end to it. If you do ethical practice, even if you do ethical practice, which you must, there is no end to how much you can earn if you have your own hospital. Because I'll tell you the sad part. Patients come through me. They come for the breast surgeon, but I am giving a patient to the system for medical oncologist, for radiation oncologist. They are the ones who are earning more and more, but they are not bringing the patient to the system. But your hike doesn't depend upon what they are earning. So this is where now the corporates are forming team systems, where there are surgical oncologists, that is breast, whoever that is organ-based. I am generalizing the word surgical oncologist for organ-based surgeons. So surgeons, medical and radiation, because there is this undue growth of medical oncologists because of the cost of the drugs. And radiation oncologists hardly bring in any patients to the system. They are not the primary ones that patients go to. In most cases, there are some seniors who do have their own clientele. There are some senior medical oncologists who have their own name and clientele, but I'm talking in general. So nowadays, the hospitals are forming teams to account for this lack of balance. So that way, I think if you have your own setup, then it's a different thing. Otherwise, I think it will cap somewhere. If we consider today's numbers for 20 years projection, maybe it will cap at 12, 15. Yeah, and then as a person, you can only do so much. If you build a team, you have to share the revenue with the team. I think that is the way forward. There's no one-man show.
How do you think AI is going to affect this branch?
It will help this branch because breast screening is very important. current breast cancer risk for women in India is 1 in 20 to 24. And mammographies are done many times. There is a lesion on mammography, but unfortunately it somehow skipped the eye of the radiologist because they are overworked, or they are sitting in a diagnostic center, or the quality. I think AI will help in detecting all these cancers early and precancerous changes early. And there's so much more variety in pathology. I think AI will help even in pathology as well. And treatment algorithms. I think ये second, third, 100th opinion वाला काम भी AI कर सकता है. Of course, treatment को डॉक्टर को ही देना है. But this having an algorithm, the current day and age, the breast cancer treatment is mathematics. This is your ERPR HER2 type. This is your Ki67. This is the tumor size. This is the lymph nodal status. This is the grade. This is your age. This is your family status. This is your family history. Your treatment is this. There are very few situations where you are in a dilemma. कि ये करना है कि वो करना है, पहले कीमो देना है कि पहले सर्जरी करना है. Very few situations. In most of the situations, it's a very mathematical thing. So I think patients will also get reassured if they have an AI system that reassures them, also gives them a reason, why we are doing this. So we are going, though you have the same ARPR, you have same IHC, same stage as that lady, but your Ki67 is high or whatever this is, you are going for chemo first and they are going for surgery first. So these kind of answers also I think AI can give. Of course, doctors will also give. But there is no going back from the fact that patients do Google their treatment plans. They put in ChatGPT. First of all, they begin with searching breast surgeon near me. If you are not on Google, you are not having a practice.
Now ChatGPT marketing has come. You can see agencies telling ki get yourself listed on ChatGPT. वो भी नया schemes आ गई है. Okay, doctor. Now we are moving on to the rapid fire. All right,
Okay.
Some interesting questions that I have for you. Okay, are you ready? Simple
Yeah.
to rules. You have to be super spontaneous and super
Yeah.
truthful.
Sometimes I may not have an answer also.
That's okay. 20 years from now, when someone Googles your name, what do you want them to find that has nothing to do with awards and influence?
I want them to remember me or find me as the most empathetic, most efficient breast cancer healer.
Healer is the
Healer.
right word.
Yeah, I want them to be cured and healed.
I really like that. If your daughter said someday, Mom, I do want to become exactly what you are, surgery, breast and endocrine, all of it, she wants to become a doctor, would you bless it or warn her?
I'll warn her. Very straight answer.
A food you can never say no to.
Dal chawal.
One thing you always do before a major surgery.
So as I said, prayers.
Yeah.
Channeling the universal energy.
A trend in Indian medicine you want to end immediately.
This poaching. Yeah, this poaching and moving hospitals for hike, I think gets nobody anywhere.
I think it's part of the corporate culture.
Yeah, I don't like
और
it.
growth कैसे होगी?
Yeah, I think the sitting in insecurity, whether you will be in this hospital, कहीं जाना है, वहाँ जाना है. I want to sit in one place, do my work, do good to patients, take my salary home, be happy in my life.
A book you have reread every year.
I won't say every year, but many times is Autobiography for Yogi by Paramahansa Yoganand ji.
One thing that instantly lifts your mood.
Shopping.
Your most controversial opinion about marriage.
I don't want to give that opinion. I'll tell you later.
But still try.
No.
If you could swap lives with someone for a day, who would that be?
No one.
The funniest question a patient has ever asked you.
Yeah. So they want laparoscopic surgery for breast. It's a very regular thing. Laparoscopy is done for abdominal organs. I mean, what they are thinking that minimally invasive.
True.
Yeah, tumor, for removing tumors in the breast, except for few situations, we can't do that minimally invasive kind of a thing.
The funniest DM you have ever received on Instagram.
Funniest or irritating? Somebody said, today in this video you look like a doctor. I'm like, what do you mean? I didn't want to obviously ask them. They said, today you look like a doctor.
Best advice your mother ever gave you.
I think she gives many advices. I think the best is just follow what your heart says. Don't have to follow the trends.
Thank you so much, Dr. Ramya.
Thank you, Dr. Nachiket.
It was lovely talking to you. A lot of good insights, lots of, the realities of modern surgery. And I believe that there's a lot of gender bias still happening in the field. But I'm sure rebels like you can help people overcome that.
calling me a rebel scares me. No, I'm just a very efficient person doing my own thing, but not letting anyone walk over me. I think that's what I'm doing. Thank you so much for having me.
Thank you so much, Dr. Ramya, and thank you so much, guys, for watching today's show. I think the field of breast and endocrine surgery has been explained beautifully by Dr. Ramya. The people who want to get into this field, they should watch this video completely. And if you are not that person, share that with a friend who plans to become a breast and endocrine surgeon in the future. Thank you so much. And as always, do not forget to like, share, and subscribe. Thank you so much, and God bless you.